Hi, I'm Brendan Eager. I work for the Analytics and Applications team for Partners in Health. Partners in Health is an international healthcare nonprofit. We work in 10 countries around the world. We partner with local ministries of health and work most often in kind of rural areas with low internet connectivity and power. We've worked in Haiti for over 35 years, Rwanda for 20, Peru for 20. We're in 5 countries around Africa and South America as well. We need software that works online and offline, given the internet issues. We've been working with Excel-based budgets for a long time. Had always kind of considered looking at different budget software. Most kind of broader solutions were requiring an online presence. We knew that was going to be difficult for our end users. So I was in Sierra Leone and we were kind of working with Vena to set up some tests and some proof of concepts, check it from different locations, make sure the connectivity was good and everything went well. Move forward, we asked for a really specific demo and something we think is really complicated, that integrating our kind of grant budgets into our general budgets, and Vena was able to take these high-level requirements, turn around a really fantastic proof of concept that just blew us away. So after kind of seeing this great proof of concept, proving that the connectivity works, we thought this is a great product to move forward with a great team.